Our correspondent Ravinder Bawa joins me in the studio. Now, she's been tracking the story for the last several weeks. Also, Dr. Purnima Advani, former chairperson of the National Commission for Women, is with us in our Mumbai studio. I want to come to you, Ravinder, first. Explain to our viewers what our cameras did not capture. You were in these clinics for several days tracking this story. How many girls are coming? Is this really just a one-off, this young girl from the 12th standard, or are there lots and lots of young girls who are now doing this for pocket money?
Rahul, there are lots of girls who are coming, and doctors have accepted to us and have admitted the fact that they do get a call per day. So from that, you yourself can imagine the students, the way they are coming forward, and they are coming to these clinics to find out how this is done, what is, at least at the level of inquiry, there is an outpour of people into these clinics. But in terms of actually donating an egg, the percentage could be a little less than, say, one per day. It will be, say, one per month in one clinic. But there are girls who are coming forward, and they are coming especially for financial reasons, either for pocket money or for other accessories, and some of them are even funding their education, just like this girl we spoke to. She comes from another state and she's funding her education through this.
But there are also case studies where there are young girls who are doing this because they want to get a cosmetic job done. For example, they want a procedure done, they need some easy pocket money, their parents aren't prepared to pay, they believe this is an asset they can use. Dr. Rita Bakshi is an infertility clinic expert. She now joins us. Dr. Bakshi, I want to understand from you the most disconcerting part of this expose. Ravinder's story shows that these clinics aren't explaining to the young donors the dangers of donating eggs. So they're getting into this situation not fully knowing and comprehending what problems there could be in the future.
I agree with you, Rahul, that the knowledge that should be passed on is very, very important. And I'm not sure whether we are able to, or as infertility experts, doing a justified job to it. But you see, the ICMR guidelines, which keep changing and which are not constant, are already, they have already prohibited relatives donating eggs, relatives doing surrogacy. Then where do we get the donor eggs from? And that is what encourages these young girls probably. See, as an infertility expert ourselves, we really look at married women or, people who have already have their children. But I'm sure there must be many clinics, and there must be as number of donors who will be unscrupulously using this as a fact and to earn money, just like surrogacy.
Dr. Purnima Advani, having these Indian Council of Medical Research guidelines seems to mean very little. The fact is, you can have any number of guidelines, but till the time somebody implements them to the T, it's going to make no difference. You can have laws, you can have guidelines, but somebody needs to clamp down on these unscrupulous clinics.
Rahul, I completely agree with you. Now, action needs to be taken at several levels. First of all, the punitive action on these clinics, so that they should know that there is a law, but there has to be a law in place, and after that, punitive action on the clinics. The clinics should know, and there should be some deterrent impact on them, that they cannot just keep ruining the lives and health of young girls. Because the moment you inject these endocrinal injections in order to stimulate the oocyte formation, you're really playing with the life and health of the young girls who tomorrow have to be married women. So I think this is absolutely absurd, the way things are going on. We have not been able to crack on it, which is the saddest part of the story. And also I would like to say with a note of sadness, that the way that the institutions like ICMR and Indian Medical Council are functioning, because they are so immersed in their own politics that they are hardly able to really get out of it and see what is for the good of society. Having said that,
okay,
let me also underline the important role of a family. I think parental role cannot be substituted with anything in the world, because it's the parental role which really decides what are the priorities which a young teenager flags off in life. It is the extra bucks to earn, or is it something better in life to do?